Gallstones are a common condition affecting the gallbladder, a small organ under the liver. The gallbladder stores bile, a digestive fluid from the liver. Imbalances in bile can harden into gallstones. These stones vary in size and can cause discomfort. Understanding gallstones is essential as they can affect anyone. The condition often goes unnoticed until severe symptoms appear. Symptoms can impact quality of life, causing pain and digestive issues. Early identification and treatment are crucial. This essay will explore causes, symptoms, and treatments. We will discuss risk factors and diagnosis. Practical lifestyle tips to prevent gallstones will be provided. By the end, you'll understand gallstones and make informed health decisions. Let's begin by defining gallstones and their formation. Gallstones are hardened deposits that form in the gallbladder or bile ducts. They are primarily composed of cholesterol, bile salts, or bilirubin. Gallstones form when these substances in bile become imbalanced and precipitate out of solution. Cholesterol gallstones are the most common type, making up about 80% of cases. These stones develop when the liver excretes more cholesterol than bile can dissolve. Over time, the excess cholesterol crystallizes and forms stones. Pigment gallstones are composed mainly of bilirubin and are often associated with certain medical conditions. Gallstones can vary in size, from a grain of sand to a golf ball. Some individuals may have a single stone, while others may develop multiple stones. Many people are unaware they have gallstones until they experience pain or complications. Understanding gallstone composition is important for treatment. Treatment options will be discussed later. Next, we will examine the primary causes and risk factors for gallstones. Gallstones form due to an imbalance in the substances that make up bile. This imbalance can be caused by several factors, the most common of which is excess cholesterol. When the liver secretes more cholesterol than bile can dissolve, the surplus can crystallize and form stones. Another cause is an excess of bilirubin, which can occur due to conditions like cirrhosis and biliary tract infections. The risk of developing gallstones increases with certain conditions and lifestyle factors. Being overweight or obese is a significant risk factor, as is being female, particularly for women who have had children. Age is also a factor, with individuals over 40 being more susceptible. Additionally, a family history of gallstones can increase one's risk. Other risk factors include rapid weight loss or fasting, which can alter the balance of bile components and promote stone formation. People with diabetes and those who take cholesterol-lowering drugs may also be at higher risk. Understanding these risk factors is crucial for both prevention and early detection of gallstones. By recognizing these causes and risk factors, individuals can take proactive steps to reduce their risk of developing gallstones. In the next section, we will discuss the symptoms and potential complications associated with this condition. Gallstones can be asymptomatic, meaning they do not cause any noticeable symptoms. However, when symptoms do occur, they can be quite painful and disruptive. The most common symptom is sudden severe abdominal pain, known as biliary colic. This pain is typically felt in the upper right abdomen or below the breastbone and can last anywhere from 1 to 5 hours. Other symptoms include pain between the shoulder blades or in the right shoulder, nausea, and vomiting. Some individuals may experience fever and chills, as well as jaundice, which is the yellowing of the skin and eyes. Itchy skin and diarrhea can also occur in some cases. Complications from gallstones can be serious and require immediate medical attention. One such complication is acute cholecystitis, which is the inflammation of the gallbladder. Gallstones can also block the bile ducts, leading to infections or affecting other organs in the biliary system. This blockage can result in severe pain and requires urgent care. Recognizing the symptoms of gallstones early can help prevent these complications. In the following section, we will explore how gallstones are diagnosed and when it is necessary to seek immediate medical help. Section 5. Diagnosing gallstones and when to seek help. Diagnosing gallstones typically involves a combination of imaging tests and blood work. The most common imaging test used is an ultrasound, which can effectively detect the presence of gallstones. Other imaging methods, such as CT scans or MRIs, may also be used to provide a more detailed view of the gallbladder and bile ducts. In addition to imaging tests, blood tests are often performed to check for signs of infection or inflammation. These tests can help determine whether the gallstones have caused any complications that require treatment. It is important to undergo these diagnostic procedures if you experience symptoms suggestive of gallstones. Seeking immediate medical care is crucial if you experience intense, unmanageable abdominal pain, jaundice, or a high fever with chills. These symptoms may indicate a serious complication, such as a blocked bile duct or an infection, which can require urgent intervention. Early diagnosis and treatment can prevent more serious health issues and improve outcomes. In the next section, we will discuss the various treatment options available for managing gallstones and alleviating symptoms. Section 6. Treatment options for gallstones. The goal of treatment for gallstones is to relieve symptoms and prevent complications. There are several treatment options available, ranging from medication to surgical interventions. The choice of treatment depends on factors such as the size and type of stones, the severity of symptoms, and the presence of any complications. Medication may be used to dissolve cholesterol stones, although this approach is less common and typically reserved for individuals who cannot undergo surgery. Surgery, specifically cholecystectomy, is the most common treatment for gallstones. This procedure involves the removal of the gallbladder and can be performed laparoscopically, which is minimally invasive and involves small incisions. For certain patients with functioning gallbladders and small stones, a non-surgical option called extracorporeal shockwave lithotripsy (ESWL) may be used. This method utilizes high-energy sound waves to break up the stones. Other less common procedures, such as percutaneous therapy and endoscopic gallbladder stenting, may be considered in specific cases. Discussing treatment options with a healthcare professional is essential to determine the most appropriate approach for each individual. In the next section, we will provide lifestyle recommendations to help prevent the formation of gallstones. Section 7. Lifestyle recommendations for prevention. Preventing gallstones involves adopting certain lifestyle changes that can reduce the risk of stone formation. One of the most effective strategies is maintaining a healthy weight through regular exercise and a balanced diet. Being overweight or obese is a significant risk factor for gallstones, so weight management is crucial. Dietary changes can also play a key role in preventing gallstones. A diet that is low in fat and rich in fruits, vegetables, and whole grains can help regulate bile production and reduce cholesterol levels. Avoiding rapid weight loss and fasting is important, as these practices can alter bile composition and increase the risk of stone formation. Engaging in regular physical activity is another important preventive measure. Exercise not only helps with weight management but also promotes healthy digestion and bile flow. Incorporating these lifestyle changes can significantly reduce the likelihood of developing gallstones. By making these adjustments, individuals can take proactive steps to protect their gallbladder health. In the conclusion, we will summarize the key points discussed in this essay and encourage readers to seek medical advice if they experience symptoms of gallstones. Section 8. Conclusion. Understanding gallstones is essential for managing this common condition effectively. Gallstones are hardened deposits that form in the gallbladder due to an imbalance of substances in bile. They can cause significant discomfort and lead to serious complications if not addressed promptly. We have explored the causes, symptoms, and treatment options for gallstones, as well as the risk factors that increase the likelihood of developing this condition. Early diagnosis through imaging and blood tests is crucial for effective treatment and prevention of complications. Lifestyle changes such as maintaining a healthy weight, following a balanced diet, and engaging in regular exercise can significantly reduce the risk of gallstones. These proactive steps can help individuals maintain their gallbladder health and prevent the formation of stones. If you experience symptoms of gallstones, it is important to seek medical advice promptly. Early intervention can prevent more serious health issues and improve quality of life. For more information and support, consult with healthcare professionals and explore additional resources. Section 9. Patient Story, a real-life experience. To bring a personal touch to our discussion on gallstones, let's consider the story of Mary, a 45-year-old woman who experienced severe symptoms due to gallstones. Mary first noticed discomfort and pain in her upper right abdomen after meals, which she initially attributed to indigestion. Over time, the pain became more severe and frequent, prompting her to seek medical attention. After undergoing an ultrasound, Mary was diagnosed with multiple cholesterol gallstones. Her doctor recommended a laparoscopic cholecystectomy, which is the surgical removal of the gallbladder. The procedure was successful, and Mary experienced significant relief from her symptoms. Following her surgery, Mary made several lifestyle changes to prevent future issues. She adopted a low-fat diet, increased her intake of fruits and vegetables, and incorporated regular exercise into her routine. These changes not only helped her maintain a healthy weight, but also improved her overall well-being. Mary's experience highlights the importance of early diagnosis and intervention for gallstones. By recognizing the symptoms and seeking medical help, individuals can effectively manage this condition and reduce the risk of complications. Mary's story serves as a reminder of the positive outcomes that can result from proactive health management.